Okay, now on to item 3, Consolidated Action Plan Update from Ms. Ferriol, who's the Director of Housing and Community Development.
Good morning, Mayor, City Commissioners, City Administration. I'm Jennifer Ferriol, Director of Housing and Community Development. I'm going to turn over this presentation to Jeremy Hagler. He is our Housing and Community Development Administrator. He and Mark White, who is also here, worked extremely hard on putting together the city's consolidated plan, which is a 5-year plan that is provided to HUD to outline the goals or the items I will be addressing over the next 5 years, and then he will also be discussing the annual action plan, which talks about how we're going to be using our funding over the next year. So with that, I'll turn it over to Jeremy.
Thank you, Jennifer. Good morning, Mayor, City Commissioners, and City Administration. Again, Jeremy Hagler, HCD Administrator. Today I'll be talking or presenting on the Resolution 14920, which includes the Consolidated Plan, Annual Action Plan, and Citizen Participation Plan. So just a quick agenda, a consolidated plan overview, the citizen participation plan and outreach, the consolidated plan goals for the next 5 program years, the annual action allocations for this year, this program year, and then the following next steps. So first, what is the consolidated plan? The consolidated plan is governed by CFR, 24 CFR Part 91. It's a 5-year plan carried out through annual action plans. The annual action plans are concise summaries that they present the actions, activities, and specific federal and non-federal resources that will be used. Again, this consolidated plan specifically will be covering program years 2020 through 2024. The annual action plan is this one that you'll be approving, hopefully, will be the first year, which will be for the program year 2020. So the consolidated plan, again, it has to be submitted to the Housing and Urban Development, HUD, for approval. It serves as the Comprehensive Housing Affordability Strategy, Community Development Plan, and it's a submission for funding. The funding that it addresses is the federal formula grant programs, the first one being the Community Development Block Grant, the Home Investments Partnership Program, or HOME, and the Housing Opportunities for Persons with AIDS, or HOPA programs. So with the consolidated plan, we also submit the citizen participation plan. And the CPP, what it does is it sets forth the city policies and procedures for the citizen participation plan, specifically with the 5-year consolidated plan, the annual action plan, and our end-of-year consolidated annual performance and evaluation report, or commonly known as the CAPER. It also outlines the policies and procedures for amendments to the comp plan and action plan, the number of public meetings and hearings, and the time frames that are required with our public notices. So when we did the citizen participation plan, we had targets for our outreach, and of that is the broad community, all residents of West Palm Beach, minorities, persons with disabilities, and the residents of public and assisted housing. And the modes of outreach, how we reached them, were first through public meetings. So we did our first one due to COVID virtually. That was April 15th. Then we have the second one coming up with the City Commission, October 19th. The second mode was the Palm Beach Post advertisements. We did a total of 5 from February, March, June, August, and September of this year. We also did an internet outreach, which we posted information about the consolidated plan and the annual action plan on the city website and social media platforms. And then lastly, what we did is we opened up a survey for feedback within citizens. So we had anywhere, depending on the question, between 54 and 57 respondents. And that was from March through April. So when we started this, we consulted with the Cloudburst Group, and they're a leading consulting agency within the HUD. HUD actually contracts them to, with TNA, answers questions, all forms of different expert technical assistance. So Cloudburst, they provided the city with a market analysis and a needs assessment, and as well they provided additional expert guidance. So from that market analysis and needs assessment, and the citizen participation, because we had the survey, HCD, we formed a strategic plan. And from that strategic plan, we formulated 5 goals. The first being affordable housing, Second, homelessness assistance and public services. Third, infrastructure and public facilities. Fourth, economic development. And fifth, administration. So the first goal for the consolidated plan is the affordable housing, and that is to increase or preserve the supply of affordable housing available to very low, moderate, middle income West Palm Beach residents. And we do this through new construction, rehabilitation, financing, pre-construction, home repair assistance, and emergency repair of rental and homeowner housing. And one thing I would like to note is on all of these goals, we kept them pretty general, broad. We didn't want to make it too specific, but then that way it allows us some flexibility in the different goals that we want to accomplish through the 5 years. It's kind of hard to forecast everything going forward through 5 years. Goal 2 was the homelessness assistance and public services. So providing supportive services to the elderly, mentally, physically, and developmentally disabled, persons with drug addictions, homeless, HIV, at-risk youth, victims of domestic violence, veterans, ex-offenders, and as well increasing services for education of mental and physical health, housing conditions, quality of life, and economic conditions. Additionally, through the HOPWA program, the city will be providing housing support to individuals with HIV or AIDS. The third goal is the infrastructure and public facilities. This is to provide and improve public improvements and facilities to areas that serve predominantly low and moderate income residents or at-risk populations. And these activities include construction or rehabilitation of community facilities, parks and recreation, homeless facilities, spot demolition, clearance, and public infrastructure. Goal 4 is the economic development. This is to increase the local economic development through loans, grants, or technical assistance to small businesses and micro enterprises to create jobs for low and moderate income residents. And the last consolidated goal is just the administration. So it's to administer the CDBG home and HOPWA funding accurately and effectively to comply with all federal regulations and promote fair housing rights and initiatives. So the next slide, it shows the annual action plan. So this is this year's award. We got a little over $1 million in CDBG, a little over $478,000 in home, and a little over $3.2 million in HOPWA for a total of $4.7 million. So the CDBG funding for this program year, which started October 1st, is broken down with public services, public facilities, and administration. So of the a little over $1 million, we have $152,000 going to public services, $659,000 going to public facilities, and a little over $200,000 going towards the administration of the program.
Commissioners, I want to add on this slide. So essentially, the public service portion that will go to assist homeless individuals with mental health services. So that's what that funding is allocated for. The public facilities and improvements portion of it is to complete the new Vickers House facility that we've discussed. This project is 100% federally funded. So this will come in for the construction portion of it. And then, of course, the administration goes to support all of the staff salaries to support these programs and pretty much make sure that we're compliant with it.
Then within the,
I'm sorry, another question, Commissioner.
Just a quick question, and it's interesting that on that slide, the number changed. My question was about the administration. So within the federal grants, they allow for us to line item an amount to cover the administrative costs. That would be staff, I would guess even benefits of staff and any administrative costs. And
That is correct, Commissioner. So for every grant program, you'll see a percentage. There is a cap. So for example, for CDBG, there's a 20% cap of your annual funds or any program income that you generate. There is a maximum that you're able to set aside for admin. And yes, it is used, we use it mostly for staff salaries, but it could be used for consultant fees aligned with these projects. It could be used for training or whatnot. But yes, all of that is required or allowed by the funding source.
Great, thank you.
then within home, for this year's annual action plan, we have $258,000 towards home buyer assistance, $100,000 towards our tenant-based rental assistance, and then the administrative, this year it's at 25% with a HUD waiver cap of $119,000 for the total home of $478,000.
Jeremy, if you can explain the 25% HUD waiver. So going back, typically for home, they only allow us up to 10% admin. But because of COVID-19, they are giving some waivers for administration costs or administrative costs because they understand that we have taken a huge undertaking with the additional COVID funding that we've received and all of the different programs that we're putting forward to address those who have been impacted by COVID. So they allowed us a little bit in terms of capacity to undertake these programs.
Then within HAPA, we have tenant-based rental assistance of $2.9 million, supportive services of $100,000, project sponsor administration of $117,000, and grantee administration for $96,000. That's the total of the $3.2 million. And then lastly, just the next steps. So the first, October 1st this year was the first year of the fiscal year, as we all know, and the first day of our program year. The next step would be City Commission approving of Resolution 14920. After that, upon the approval of the Commission, we would submit the Consolidated Plan, Annual Action Plan, and the citizen participation to HUD. And within 45 days, HUD should either approve or let us know anything that we need to change. And then all of that needs to take place before August 2021, excuse me, of next year. And
Commissioners, I'm sorry, Jeremy, go
I
ahead.
was just going to say that concludes my presentation. Yeah.
I also want to add that typically the action plan and the consolidated plan, they're due on August 15th of every year, so 45 days before the beginning of the new fiscal year. However, because of COVID-19, HUD actually granted us an extra year to finalize this. We wanted to to finalize it. We were already completed it, but they did allow us some extra time just because they understand all of the considerations for COVID, all the different programs we had to put out. So that's why they were able to give us an extension to submit.
Very good. Very fine presentation. Yeah, Commissioner Lambert.
Thank you. And I recall at the beginning of COVID seeing announcements about your community outreach on this. And so I was impressed that we were moving very quickly on having virtual meetings to be able to still collect that community input. I'm guessing that I'm hopeful that you still had good community input, given that you're probably reaching a target audience of service providers and people who work in this space and provided input. But maybe could you just share with us the type of feedback that you received?
We'll be happy to share. Jeremy, did you have some printouts?
Yes. So on that survey, that was the primary citizen feedback. I believe that was the only feedback we got officially. We did, like I said, we had between 54 and 57 respondents, depending on the type of question. Within that, we had 46% African-American respondents, 42% white, 12% that identified with other. We also had 66% of them were female, and 34% were male, I'm sorry. And then within that, they identified, and part of that was we took the needs assessment, the market analysis, and then the survey, and that's how we came up with the strategies. So within that survey, they identified home buyer assistance is very important, rental assistance is very important, persons with disabilities, as far as transition permanent housing for homelessness, to prevent homelessness. So these were some of the highlights, as well as they wanted to see homeless facilities, healthcare facilities, and mental health facilities. And all of those identified with either like a 60% or higher. So we identified those needs in the community.
And I'll also add, Commissioners, so that was part of the resident feedback, but we're constantly in communications with social service providers, with our nonprofits, with our other agencies, with the county, just to assess where our needs are and where we can best allocate it. So that conversation is an ongoing conversation, and they were also provided feedback in terms of this plan. We needed to consult with the housing authorities, so we got assistance from them as well. So the action plan actually requires us to do that anyway, but we have that ongoing communication.
Thank you.
And how many respondents did you get to the internet survey?
It depended on the question, anywhere from 54 to 57.
1,000?
No, people.
People,
Yeah.
total? Okay.
Yes, sir.
And how many were part of that first public meeting we had? Probably had about 40, 50?
Yeah.
Okay. Any other, Commissioner Fox.
Thank you both so much. I just had a question about The goals are, obviously really challenging and lofty, and I just wondered, is there a way for us to know what the actual plans are for the goals that you have? I mean, how you're going to move forward with, the jobs and the public infrastructure, and just like what's in those categories? And, also when you're mentioning some of the things like rental assistance, like how would people find out about it? Are there ways that those of us up here could be sharing this information to make sure that the right people are getting the resources that they need?
Do you want to take that on?
Okay, so there were quite a few questions within that one question. So
sorry
just
about that.
the first one being, so how do we identify within those goals? So the goals, like that's kind of why I forgot before I started the first goal, but they're broad. So we have many activities in there, so we have flexibility of what we can accomplish or what those community needs are as they change through the next 5 years. Within the action plan, then what we do is we narrow it down. So then that's why we present the annual action plan. And we're saying, hey, these are the specific, services or programs that we're going to be running for that year. And this is what we plan to accomplish. And HUD holds us accountable to that too. We don't just present to you. And then, we have to actually present outcome numbers, which that's part of the caper that I mentioned in the presentation. And you can actually see what our goals were as opposed to what our outcomes were, how well we met those goals.
And I'll say, you don't have to meet all of those goals in that same year. So remember, your goals are 5-year goals, and they're only for your federal resources. So for example, in this year, I can tell you with CDBG, we touched the public service portion of it, and we touched the public infrastructure. So those are 2 goals that we touched on CDBG. On home, we touched the rental assistance, which is affordable housing, and we touched home buyer assistance, another affordable housing. And with HAPWA, again, affordable housing and assistance for social services. Mm-hmm. So just because they're outlined within those goals doesn't mean that every year you're going to have funding to address every single one of those goals. And I'll also say that although this Consolidated Plan and Action Plan outlines our federal resources, we do have other resources outside of the federal funds that we'll use to further move forward with these goals. So that could be our state dollars, any general fund dollars that we use to allocate or to match our federal resources.
And then to address your question about the notification. So we're required to put out public notices. And so that's one of the very specific, always we put that out so people are aware of the programs that we're doing, and they can apply or whatever with contact information. We have email, phone number, things of that nature.
And also working with communications as well, with Kathleen's group and putting everything out on social media, word of mouth. Again, we partner really closely with our social service providers, and that's a big part of our assistance. It's making sure that we get the referrals and letting them know. One group that I can think of is RISE. Every time there's a program opening, they put it out. So it really is all of those strategies combined and how we get the word out. And I'll say, the funding that we received is very, very minimal. As you can see, it's not a lot. And you look at $1 million and you think, for a rehab, $1 million, let's say we used $1 million for rehab. That's only for a couple of homes a year. So the resources that we have are very, very limited. But we do the best that we can to get the word out and get as many people as possible.
Any follow-up, Commissioner? Commissioner Lambert?
On that note, Jennifer, I don't know if you know this statistic off the top of your head, but I have heard in other community conversations about how much it costs annually maybe to help a homeless individual get off of the streets. I don't know if that's I guess what I'm getting at is that it takes considerable resources to be able to provide services, have follow-up, that it's not just you reach out one time and miraculously they're now in a home.
Right. Armando just came over and gave me the statistic that he says it between $35,000 and $50,000 a year per homeless person. And you're talking about rental assistance, you're talking about mental health services, you're talking about the case management that's needed. We're talking about, it's not just 1 year. A lot of folks may need additional assistance for years to come. So yeah, it's very, very expensive to provide that service.
Very good. Any other questions, Commissioners? Excellent report, Jeremy, Ms. Ferriol. Appreciate it.
Great, thank you.